What if you were told a sugar pill could relieve your pain just as effectively as an over-the-counter drug? Intriguing, isn't it? This fascinating realm of the mind, where perception can shape reality and belief can manifest as physical change. We're diving into the enigma known as the placebo effect, a phenomenon that has bewildered and fascinated scientists and doctors alike. Picture this. You've been feeling under the weather, and your doctor prescribes you a pill. You take it, and lo and behold, you start to feel better. But here's the twist. There was no active medication in that pill. It was merely a sugar pill, a placebo, yet your belief in its healing properties spurred your body into recovery. This, listeners, is the essence of the placebo effect, the compelling testament to the power of the mind over the body. Incredibly fascinating, aren't we? The placebo effect is more than just a medical curiosity. It's a fundamental component of clinical trials, the rigorous tests that new drugs must pass before they can be approved for public use. In these trials, a group of patients may be given a placebo, an inactive substance that looks just like the drug being tested. This is done to ensure that any improvements aren't just down to the patient's belief in the treatment, but are indeed due to the drug's efficacy. However, it's not all about trickery and deception. The placebo effect is a genuine psychological and physiological response. It's a testament to our brain's ability to influence our health, a reminder that our mind is a powerful tool that can be harnessed for healing. But the placebo effect isn't just about sugar pills and saline injections. It's also about the patient's experience, the care they receive, and the trust they place in their caretakers. It's about the power of positive thinking and the role of expectation in shaping our health. So the placebo effect harnesses the power of your mind, turning a simple sugar pill into a tool of healing. But how does this really work? Stay tuned as we delve deeper into the science behind this fascinating phenomenon. The placebo effect is not just about belief, it's a complex interplay of psychology and physiology. This phenomenon, often misunderstood, is a testament to the power of the mind and how it can influence the body. You see, the placebo effect is rooted in our expectations. When we receive a treatment, our brain anticipates a certain outcome. If we believe that a pill, for instance, will alleviate our pain, our brain can actually trigger the release of endorphins, our body's natural painkillers. This response can be so powerful that it mimics the effect of actual medication. Now, let's add another layer: conditioning. Picture Pavlov's dogs salivating at the sound of a bell. Just as those dogs were conditioned to associate the bell with food, we humans can be conditioned to associate certain stimuli with the effects of treatment. If we have a positive experience with a treatment, our brain can associate the circumstances surrounding that treatment, the smell of the doctor's office, the taste of the pill, with the positive outcome. So, the next time we encounter those stimuli, our brain might just trigger a similar response. But the placebo effect isn't just about tricking our brains into releasing endorphins. It's also about our perception of pain and how we interpret it. You see, pain is a subjective experience, influenced by a myriad of factors from our mood to our environment. When we believe we are receiving treatment, our perception of pain can actually shift, making us feel better even if the underlying condition hasn't changed. And while this might sound like a miracle cure, it's important to remember that the placebo effect has its limitations and potential side effects. Can you placebo your way out of any illness? And are there any drawbacks to this mental magic trick? Very good question. The placebo effect, while fascinating, doesn't have the ability to cure every disease or ailment. Despite the power of positive thinking, your mind can't wish away a broken bone or eliminate a bacterial infection. It's crucial to understand that while the placebo effect can contribute to symptom relief, it's not a standalone cure. One of the primary limitations of the placebo effect is its variability. Different people may experience different levels of relief from the placebo effect, and it's not entirely understood why this is the case. Some individuals might feel a significant improvement in their condition, while others may not notice any change at all. Another limitation is that the placebo effect is often temporary. The relief or improvement a person experiences is seldom lasting. Once the individual realizes they've been taking a placebo, the effect often diminishes. Moreover, relying solely on the placebo effect for treatment can lead to serious consequences. When a person with a serious condition relies on a placebo instead of seeking necessary medical care, they risk their condition worsening over time. For instance, someone with diabetes cannot manage their disease with placebos alone. This brings us to the potential side effects of the placebo effect. Yes, even a placebo can have side effects. These are known as nocebo effects. If a person believes the placebo might result in negative outcomes, they may experience those very outcomes, even though they're not caused by any active ingredient. Lastly, it's worth noting that the placebo effect can influence clinical trials. If a significant number of participants experience relief from a placebo, it can be challenging to determine whether an actual medication is effective. The placebo effect is a fascinating phenomenon, but it's not a one-size-fits-all solution to health problems. With that said, recent studies have shed new light on its potential applications. The Conversation published "Cannabis is no better than a placebo for treating pain" new research on November of 2022. Science never stops, and neither does our understanding of the placebo effect. One of the fascinating recent studies focused on the use of marijuana for chronic diseases. The researchers posited a controversial idea. Could much of the pain relief experienced by individuals using marijuana be attributed to the placebo effect? The placebo effect, as you might recall, refers to the positive expectations that a dummy pill or treatment will provide relief. In the study in question, a striking 67% of the pain relief associated with genuine cannabinoids was found to be a placebo response. That's more than 2/3 of the pain relief chalked up to the power of belief. This isn't an isolated finding. An analysis by the International Association for the Study of Pain drew similar conclusions, suggesting there is insufficient evidence to support the use of marijuana for pain relief. Previous studies have even shown that using marijuana before surgery can worsen pain during recovery and increase the need for anesthesia and opioids. But the study didn't stop at marijuana. It examined 20 clinical trials and found no difference in pain reduction between marijuana and a placebo. The placebo response was highest when blinding. The practice of keeping participants in the dark about whether they're receiving the treatment or the placebo was most successful. Interestingly, the study also noted the influence of positive media coverage on placebo responses in subsequent trials. This suggests that news and social media could be shaping our placebo responses, a finding that opens up a whole new avenue for research. These findings underscore the power of the placebo effect, but also raise new questions about its role in our healthcare system. So, what have we learned about the placebo effect? And what does this mean for our approach to health and well-being? By now, we know that the placebo effect is a powerful phenomenon, demonstrating the impressive capabilities of our mind. It's a testament to the fact that our beliefs and expectations can significantly influence our physical health. We have seen how a dummy pill or a treatment with no therapeutic effect can have a profound impact on our well-being simply because we believe it will work. We've delved into the science behind this fascinating effect, understanding that it's not just a trick of the mind, but a tangible, physiological response. We've learned that the placebo effect can trigger the release of endorphins, our body's natural painkillers, and influence our autonomic nervous system, which controls functions like heart rate and digestion. Yet we've also explored the limitations and potential side effects of the placebo effect. While it can be a powerful tool, it is not a cure-all. It can't mend a broken bone or eradicate a virus. Moreover, it can sometimes lead to adverse effects, like the nocebo effect, where negative expectations can result in negative outcomes. The most recent studies, like the one looking at marijuana use for pain relief, remind us of the importance of rigorous, blinded clinical trials in medical research. They highlight that the placebo effect can significantly skew results, making it appear as though a treatment is effective when it might not be. Understanding the placebo effect empowers us to take a more active role in our health. It encourages us to harness the power of positive thinking, to cultivate optimism and resilience, and to take care of our mental health. understanding its significant impact on our physical well-being. The placebo effect is not just about sugar pills and dummy treatments. It's a testament to the power of the mind, and a reminder that our beliefs can shape our reality in more ways than we might imagine.